Hey, beautiful people, welcome to my channel. I'm delighted to have you here once again. In today's video, we are going to be looking at evidence-based series, and we're going to be looking at the topic ankle spray. Now guys, before we dive directly into that video, I am super excited. Guess what guys? Too many passes. Anytime you see my smile, you know I get a lot of passes. I just finished doing the video on racism now, and I'm doing this one on ankle spray in evidence base. So like I told them in the racist video I did, I had a lot of messages. Prini Chi messaged me, past your skills, I'm super proud of you. Victoria Taiwo Babalola, I'm super proud of you. Ioma Precious, Pretty, Sam, this is Indian. Sune, Samo, I'm super proud of you. Isaac, I'm super proud of you. Adobe Azomta, I'm super proud of you all. Over 15-18 messages I got. I'm super proud of you all. I'm just going to share two with you. Now, guys, this is from Ioma Precious. She says, thank you, ma. God continue to bless and honor you. Chai, you make Osce easy. My evaluation was so on point that my assessor was just smiling. I finished in 3 minutes and he told me to use 5 minutes however I want. We are looking at each other till it was 5 minutes. I followed your pattern straight to the point. Oh my God, well done you on finishing evaluation station in 3 minutes. I keep saying it, Osce is simple. And of course, nurses are brilliant. And this is from Adobe Azomta. Good morning, my wonderful assessor. In as much as I was under a trust, I was watching all of your videos and assessments. Thank you so much. I passed my Osce for the first time. I was even talking like you. God bless you, my darling mama. Oh my God, I'm super excited. Now, guys, if you are writing soon, I can't read all because we're not going to do anything if I read all the messages I got. If you are writing soon, you are definitely passing. Osce is simple and nurses are brilliant. Do me a favor, share these videos to all the group you know. People are preparing for Osce exam because you are helping them to pass their Osce exam. Now, without wasting any more of your time, let's dive directly into our topic for today. To my channel. Evidence-based series is 10 minutes in your Osce exam, and it is a silent writing station. When you are writing evidence-based in your Osce exam, please look at the article summaries. You might find some answers in the article summary. That's tick. That's it. So look at the article summary. You might find some answer in the article summary. Now, guys, I'll be giving you a scenario and I'll be giving you the answers to this scenario. The answer to all your evidence base and your professional values are exactly the marking criteria. But try to understand them and write them the way it best suits you and the way you can remember. All right. So I will be giving us a scenario and I'll be giving the answer. I will try to share all or some of them on the screen. Now, evidence-based ankle spray. Overview. Read the scenario and the summary of the research below. Please identify the main point from the summary and apply the findings to the scenario below. This is a silent written station. Please write clearly and legibly. You have 10 minutes to complete the station. Now, the scenario. Mr. Ailey is a known asthmatic patient who sustained an ankle spray following a sport injury. He is now in the accident and emergency unit. He is in severe pain. You offered him prescribed paracetamol, but Mr. Ailey feels ibuprofen would be a better choice. I'll take it again. Mr. Ailey, a known asthmatic patient, sustained an ankle spray following a sports injury. He's now in accident and emergency unit. He is in severe pain. You offered him prescribed paracetamol, but Mr. Ailey feels ibuprofen will be a better choice. Now, article summary. Study A reveals that both paracetamol and ibuprofen are effective analgesic for treating mild to moderate pain. Study A reveals that both paracetamol and ibuprofen are both effective analgesic for treating mild to moderate pain. Study B shows that although some clinicians prefer prescribed ibuprofen, there is no clear evidence that it is more superior. Study B shows that although some clinicians prefer to prescribe ibuprofen, there is no clear evidence that it is more superior. Study C shows that current research reveals that is an effective analgesic for pain resulting from soft tissue injury. I'll take that again. Study C reveals that current research shows that paracetamol is an effective analgesia for pain resulting from soft tissue injury. Study D shows that ibuprofen have more adverse effects and can be contraindicated in patients who have bronchospasm, cardiac issues, and renal failure. Study D shows that ibuprofen have more adverse effects and can be contraindicated in patients who have bronchospasm, cardiac, and renal failure. Now, guys, you are going to be getting a sample like this to write your answers. Now, these are my answers in line with exactly the marking criteria. Number one, I would advise Ailey that both paracetamol and ibuprofen are equally effective analgesic. Tick. I would advise Ailey that both paracetamol and ibuprofen are equally effective analgesic. Tick. Very good answer. That both paracetamol and of course ibuprofen, they are equally effective analgesic. Number two, I would explain to Mr. Ailey that although clinicians prefer ibuprofen, there is no clear evidence that it is more superior than paracetamol. I would advise Ailey that although clinicians prefer ibuprofen, there is no clear evidence that it is more superior than ibuprofen. That paracetamol, sorry. Tick. Number three, I would inform Mr. Ailey that available research suggests that paracetamol is an effective analgesic for pain resulting from soft tissue injury. I would inform Mr. Ailey that paracetamol is an effective analgesic for pain resulting from soft tissue injury. Tick. Number four, I would explain that although ibuprofen is safe, it has more adverse effects and is contraindicated in patients who have bronchospasm, cardiac, and renal failure. I would inform Mrs. Ailey that although ibuprofen is safe, it has more adverse effects and is contraindicated in patients who have bronchospasm, cardiac, and renal failure. Finally, I would inform Mr. Ailey that because he is asthmatic, that paracetamol is more suitable. See, guys, if you miss any of these, just rewind it and go and look at it. This is a sample answer, and if you write your exams like this, oh my god, you are definitely passing. I can't wait to congratulate you. You are definitely passing. Keep practicing with your peers, keep practicing with your friends, and I would definitely congratulate you. So all the best, guys. Keep passing your Osce exam. I love you all. Bye, guys.